Good afternoon. Welcome to all our families in the 1,000 Days community. I'm Blythe Thomas, Chief Strategy Officer at 1,000 Days. We're glad that you're joining us today. First and foremost, this is a time of great uncertainty, and we are experiencing a world that we've never experienced before. We are here for you, and I know you are here for one another. We know that the first 1,000 days are a time of tremendous potential and enormous vulnerability. How well or how poorly mothers and children are nourished and cared for during this time has a profound impact on a child's ability to grow, learn, and thrive. This is because during the first 1,000 days, between a woman's pregnancy and a child's second birthday, are when the foundations for a child's lifelong health are built. Today, I am so thankful to welcome Dr. Lisa Hollier, past president of the American College of Obstetricians and Gynecologists. She is a professor of obstetrics and gynecology at Baylor College of Medicine in Houston, Texas, and chief medical officer for Texas Children's Health Plan. She completed a residency in OBGYN and a fellowship in maternal fetal medicine. Additionally, Dr. Hollier serves as co-chair of the Maternal Mortality and Morbidity Task Force for the state of Texas. She's a national resource and leader on this subject, which is one of the most serious health issues facing women in the United States. Throughout her career, she has been dedicated to reducing health inequities and improving women's health by advancing women's health policy. Dr. Hollier, good afternoon. Thank you for being here.
Thank you so much, Blythe. I am truly, truly grateful to be here online with you today. And I'm very honored to represent the American College of Obstetricians and Gynecologists, the nation's leading group of physicians providing healthcare for women. With our more than 60,000 members, ACOG strongly advocates for quality healthcare for women, promotes patient education, and increases awareness among its members and the public of the important changing issues that affect women's healthcare.
Excellent. Well, I am so excited to have you here. We have received a number of questions from our community. So if you're ready, I'd like to dive right in.
Let's do it.
Okay. First, most basic, are pregnant women more likely to get COVID-19?
Well, as you know, COVID-19 is a new illness. The first infections actually were less than 6 months ago. So researchers are still learning a lot about this infection, and we're constantly getting new updates. At this point, we're actually not sure if pregnancy makes someone more likely to get sick.
Well, that's difficult, isn't it? If a pregnant woman is to get COVID-19, what should she expect for herself and her baby?
Well, based on the current reports from some other countries, China, Italy, and reports from New York, pregnant women who get infected don't seem to have more severe symptoms than the general public, which is really good news. Many pregnant women have no symptoms at all. Some have the traditional symptoms that we think of for COVID, the fever, cough, shortness of breath. And then there's a small number of women who do get very sick. Now, when we think about pregnancy complications, for example, we have seen in some of these reports that pregnant women with COVID-19 have had preterm births. But what isn't clear is whether or not births were actually caused by COVID or if they were something that was destined to happen anyway. And finally, it's still a little bit too early for researchers to know how COVID-19 might affect the fetus. For example, we believe that it is not likely, though, that COVID-19 passes to a fetus during pregnancy, labor, or delivery, but more research is certainly needed.
We've heard that some women are considering switching to a home birth because of worry about hospital capacity and exposure to COVID-19. Can you speak to that?
You know, the fear and anxiety that so many women are experiencing right now is definitely understandable. As a mom myself, it's really heartbreaking for me to think about what women are having to face right now. I remember a few years ago being nervous for my son's birth. And for me, the hospital was an environment where I'm completely comfortable. So as a mom and as an OBGYN, I can tell you that you are not navigating this alone. Your obstetrics team is your partner in all of this. I think it's very important to remember that hospitals and accredited licensed birth centers remain safe places to give birth, even during this public health emergency. And the key, you'll hear me say this a couple of times today, is communication with your healthcare team. Your OB team can talk with you about your specific situation. They'll help you assess the risks and the benefits, and then develop a plan just for you so that you have the personalized care you need and you have access to all the resources that you and your precious baby might need.
I am so fortunate also to be a mother, but mine are teenagers now. But wow, I remember so vividly how important it was, just those plans and how it can be such a scary and uncertain time, but it's really comforting to hear you say, obviously it's about communications, but just that sense of safety that I'm seeing and feeling from you, that's just so, it's got to be really reassuring to so many of our mamas. I appreciate that very much. So there's understandably a lot of fear about how far the impacts of COVID-19 reach. We've heard about some women being concerned that they'll be separated from their baby right away after birth. Can you address those concerns too?
Absolutely. You know, this pandemic has changed so much for all of us. My life is completely different now than it was just a month ago. And there are a lot of worries that pregnant moms are having to grapple with during this pandemic. But I want to make sure that you know that even if a mom is COVID positive, it doesn't automatically mean that she'll be separated from her baby. ACOG follows the CDC guidance, and that is intentionally to reduce the risk of transmission from a mom to her newborn. And so in situations, there may be a very temporary separation of the mother who has confirmed COVID-19 disease or who is under investigation from her baby until the mother's precautions are lifted. Now, this is really important to remember. Again, discussions about whether the baby should still be in the room with the mother and the precautions that need to be taken should be made by the mother and the healthcare team through shared decision making. So this is a discussion that happens at the level of the mom and her healthcare team when a situation where a mom has COVID disease. Now, breastfeeding, though, is still very much encouraged, and it is filled with so many benefits, and there's no evidence of the virus being found in breast milk. So there may be some extra precautions that have to be taken, but I want to really reassure you that in the majority of situations, there is no separation that needs to occur.
That's also so reassuring. I remember vividly, I'm sure so many moms watching do, that when you first meet your baby and how important and special it is, and that skin to skin contact. And so it's really, I appreciate hearing that, especially about breastfeeding as well. You know, I should have backed up actually, because there are also some women today who are concerned about how COVID-19 might affect their plans to try to conceive. Is this a bad time to become pregnant?
Well, the decision to start a family or add to your family is a very personal choice. And for women who want to become pregnant, you know this, there are an awful lot of things that need to be considered. As we've been talking this morning, we've talked about how stressful our current environment is right now. And there are so many families who are coping with financial difficulties, for example. There may be job insecurities. There may be changes in health insurance or a loss of healthcare coverage. And some of these factors may mean that this isn't the best time. From a medical standpoint, you're going to want to make this decision based on your health and the potential risks of COVID-19. And we've talked about some of those things earlier today. For instance, people with some healthcare conditions like diabetes, lung disease like asthma, or heart disease, they may have a higher chance or a higher risk of severe illness if they do become infected, if they are diagnosed with COVID-19. As I've mentioned, this is a new infection, and the information that we have is limited, though we do continue to learn more every day. We don't know if there will be any long-term impact that could potentially affect women or their partners after they recover from the illness. So right now, it's just, if you're thinking about a family, it's really important to talk to your OBGYN or other healthcare professional about your specific situation.
Yeah, that's helpful and encouraging. Isn't it hard to know when is the right time? And, it's good to be reminded, again, that communication with our healthcare professionals is just so important. Let's see, hospitals again, right? Many hospitals have instituted policies that allow women to have only one support person in the room with them during birth. This has altered many birth plans. We've heard from our community that, they were planning different things in more than just their partner. So can you provide some advice to women who've had to change their birth plan because of COVID-19?
There are a lot of changes that are happening in our world right now, and I know that many women are not going to have the birth experience that they've envisioned. I think, though, that that's not entirely unique to COVID. I had a completely uncomplicated pregnancy, and then ended up having a baby who needed to go to the neonatal intensive care unit, even though I delivered him full term on my due date, in fact. So sometimes, even in normal situations, things don't turn out exactly the way we plan. But I think it's really important for women, again, to remember that hospitals and accredited licensed birth centers remain very safe places to give birth. Your care team, your physicians, your nurses, everyone who is around you, we're here for you because this is what we do and we love what we do. ACOG really recognizes that the continuous one-on-one emotional support provided by a partner or other support personnel like a doula is really associated with improved outcomes for women in labor. And our organization has encouraged hospitals to really explore some innovative solutions to make sure that laboring patients get the support that they need. What you should do, ask your OB team or call the hospital and ask them what their current guidelines are. I think it's important to remember that guidelines may be changing quickly in response to the situation at any given facility. You may find some innovative solutions like video calls. We've all been doing a lot more video calls that have really helped connect people, even when we can't be physically together.
That's such a good reminder. And you're right. We have people in our community who are joining us from, cities in all 50 states. And it is so important to be able to ask these questions of you and to get this guidance. And then certainly to make sure that you're working with your care team and with your local hospital. For those of you who are just joining us, as a reminder, we are speaking today to Dr. Lisa Hollier, immediate past president of the American College of Obstetricians and Gynecologists. So let's circle back to pregnancy. How should women expect their prenatal care to change?
A woman's prenatal care is absolutely incredibly important, and many offices are in fact changing the way we do our visits. So what you may see is that you have fewer visits. Your visits are spaced out even further. It was maybe every 2 weeks, and maybe they stretch that out just a little bit. Or in some practices, you may have a visit over the phone. Or I know a lot of practices have really started to shift to telemedicine, where you end up talking with your provider on an online video call with your laptop or your iPad or even just your cell phone. One of the other differences that you might see is that your obstetric team might reach out and call you before your appointment. And they may be asking you some questions perhaps about any symptoms that you might be having. And this really gives your team an opportunity to understand your specific situation and decide along with you which options are best for you: an in-person visit, a video visit. This is a really great way for you to still get that patient-centered obstetric care, pregnancy care that you really need. Now, I want to give you a heads up, and many of you may have already been into the offices already. When you go into the office, you're going to see some changes there too. Your team, like ours, is constantly working hard to ensure the best practices are in place in the office to reduce any chances of infection. And part of that means we've spaced out the appointments that happen during the day. We've made changes to the physical structure of the waiting room. And I've heard in some practices, they're allowing you to check in and then wait in your car for a text message on your cell phone to say, hey, come on in, now's the time. All of these different techniques that we're doing are really to help to ensure that you and your baby get the care that you need in a way that really minimizes risk. And these changes are really important. And I just want to emphasize again how incredibly important your prenatal care is. What I don't want is for you to stop getting your prenatal care. So please, once again, be in touch with your OB team, talk to them, and you can come up with a plan that really does work best for you and for your team.
That is so critical. And I remember and feel so strongly about, those times, even when you're very close and you're going in once a week and you're excited and you're so ready. And I'm so pleased that, of course, as we're seeing all this innovation around us in all the other fields, of course, your doctor's offices would be doing that same thing, finding ways to make sure that you can keep getting the care that you need. And not missing that time or sacrificing that time. So I think that's critical. I really appreciate that. And especially for women who maybe haven't even had a chance yet, maybe they're early in their pregnancy, just that acknowledgement, realization, you're going to see things a little different, and that's okay. It's still very, very, everyone's working very hard to keep it safe. So I appreciate that very much. On the other side, how will postpartum care change?
Well, one of the first differences that you'll probably see postpartum is some differences in the facility itself. Some facilities may actually allow you to go home a little bit earlier if you are totally healthy, have had no pregnancy complications, have an uncomplicated delivery, and a completely healthy newborn. Now, if there are plans that are being made for a slightly earlier discharge, your pediatrician will need to be involved early just to make sure that appropriate arrangements are made for the follow-up of your baby. For postpartum care, for your care, this is just so incredibly important. I think it's absolutely vital that we remember the importance of this postpartum time period and how important it is to make sure that women get the care that we need. I mean, I know as moms, we think a lot about our kids and what's going on with our kid, making sure our child gets in for their visits. And we really focus a lot on our children. I think it's really important for us to remember that we need to focus on ourselves too. Sure that we also get the care we need. For your postpartum visits, you can expect some of the changes that I just talked about with your prenatal visits, with an increased use of technology and video visits. I think it's really important to talk with your doctor or your midwife or other clinician prior to delivery, right? So again, you can understand what the plans are for the hospital, but you can also understand what your plans are for your postpartum visit. Are you somebody who has complications who might need to have a really early visit? Do you need to be seen within 7 to 10 days after discharge from the hospital? Are you somebody who can wait just a little bit longer? by talking with your doctor ahead of time and being able to make those plans, maybe even setting up that appointment, this really gives you the opportunity to be as prepared as possible. Of course, flexibility is still going to be important, again, because things certainly can change. But there's one extra point I really wanted to emphasize, and I think with all of that added stress and anxiety that we've been talking about through today, I think it's very likely that your obstetrics team will talk with you about your mental health. How are you really feeling? How are you coping? And may provide referrals or additional social services and give you extra access to resources that you might need in these difficult times. It's really important that your OB team do this and that you be willing to talk about all of the things that you're feeling postpartum.
That's so important. So this is not about shame. This is not about whether you're a good mom or a bad mom. It's so hard. I know it was a long time ago, but I remember it is incredibly difficult to have a 3-day-old at home for the first time mom. And gosh, relying on our experts, it's just so critical to be able to have these conversations and to ask the questions and to take care of ourselves. Moms are really good at taking care of everyone. We have to take care of ourselves for sure. And that's important on that postpartum care as well. Now, Dr. Hollier, this was not a situation for you, considering that you had your baby on your due date, but some women are actually considering induction before their due date as a way to limit their exposure to COVID-19 as cases in hospitals increase. What should pregnant women consider before being induced?
Well, right now, we're still doing inductions of labor. We are still doing cesarean deliveries as they're medically indicated. But each hospital is making decisions about how to most appropriately schedule these procedures based on a number of different factors, including the availability of resources. Again, this is another one of those situations where you really need to have a discussion with your obstetrics team because they understand your specific health situation and the specific situation in the facility where you're going to be delivered. Don't be afraid to ask. Don't be afraid to have these questions. This is a wonderful opportunity to continue to build that relationship with your obstetrics provider. I still have a wonderful relationship with my obstetric provider, and I'm so grateful for that opportunity to be able to ask questions, to get the additional information, because for me, the extra knowledge that I had made me feel more secure and less anxious about the whole situation. In general, when a woman and her fetus are healthy, induction of labor isn't done before 39 weeks. We really want your baby to have all of that time to ensure complete development prior to birth. An induction done at 39 weeks or later can be considered, though, for appropriate candidates, and it may reduce the risk of having a cesarean delivery and other complications like high blood pressure. This is based on relatively new research. However, there may be some prolongation of labor with that, and you may end up being at the hospital a little bit longer. So the bottom line of this, don't be afraid. If it's something you're thinking about, ask your obstetric provider, ask your OB team about this. And that way you can have this discussion, shared decision-making, and really be better prepared and have a really good plan for what to do.
This is fascinating. I'm so grateful for this time with you. I know we have a few more questions that we had received from our community. And I want to go back, we touched on it briefly, but I want to talk a little more about breastfeeding. Many pregnant women are concerned about how COVID-19 will affect their breastfeeding experience. What do women need to know about how breastfeeding might be different for them as a result of COVID-19?
Well, Whether and how to start or continue breastfeeding is something that really should be determined by the mother in coordination with her family and the healthcare team. Currently, the primary concern is not whether the mother would give the virus to her infant through breast milk. We don't believe that transmission happens. The concern really is the respiratory droplets, or the tiny droplets that are in the air that we breathe. And you can imagine, as you're breastfeeding, that close proximity with your baby. So it's really important that if a new mom suspects or has been confirmed that she's positive for COVID-19, that she takes all possible precautions when she's breastfeeding to avoid spreading the virus to her infant. And those are the precautions that we've been talking about throughout this pandemic, right? Washing your hands thoroughly, making sure to use disinfectant as needed, be sure that you're wearing a face mask. But again, I really want to emphasize there are so many benefits to breastfeeding. It is incredibly valuable. And if you're a mom who actually has COVID-19, definitely talk with your OB team, talk with your pediatrics team, and together you guys can make the best decision for feeding your infant. There may be some situations where pumping is best if you start out that way. But again, it's a personalized thing, and really is a discussion that's best had with you, your OB team, and the pediatrics team as well.
That's great. We are at 1000 Days. We are such big proponents of supporting women to initiate and continue breastfeeding. And so I do have to do a quick plug to say, if you're watching and you would like some more information and resources, please do go to our website, 1000days.org, and feel free to look around and use as much of that material as is helpful for you. And I'm sure the same is true at the American College of Gynecologists, ACOG, of OBGYNs gynecologists. So I do want to ask just another question. We touched on this earlier. I think mental health is such an important topic, and I don't want to miss it. So how can pregnant women deal with the added stress they feel related to COVID and protect their mental health at this time?
Well, I think it's important to understand that it's completely normal for many women to be feeling fear, uncertainty, stress, and anxiety because of all of the change that's happening and because of COVID-19. In addition to reaching out to your friends and family, your sort of postpartum team, right? You've got that group of people who surround you and support you. It's important to, as you can tolerate, begin getting some exercise and really focus on your self-care, focus on your own needs as well. But there are a lot of treatment and support resources that you can access either over the phone, you can access it online. ACOG has a lot of resources that are available for you on our patient frequently asked question, or FAQ webpage. So feel free to access those online resources. Again, please talk with your OB-GYN or your other healthcare professionals about how you're feeling, about the symptoms that you're experiencing. I want to know what you're feeling. I want to know if you're feeling sad or hopeless, worthless, helpless, if you are afraid or worrying, if you have symptoms of anxiety like a fast heart rate. As your OB-GYN, I want to know those things. I want to be able to help you. And the most important thing that you can do is be open with me, be open with us. Don't ignore those feelings. Please ask for help. There are so many resources that are out there. And your team, your circle, your postpartum circle, your friends, your family, your groups can really help you to ensure that you have access to the resources you need to get back to feeling your best.
That's so important. I appreciate that too, to visit your page as well on the frequently asked questions and just the sense of community. I think it's having a baby is not something that it was, meant to just be you and that baby. And so to be able to really have community to support you is critical, and to be able to address the challenges and the concerns that you're feeling. I really appreciate how I feel even more at ease, but I appreciate how you're really addressing for so many of the women that are watching with us today. It's okay, talk to your OB-GYN and really be available, be open, because your doctors want to help you. Prior to COVID-19, our nation was already seeing significant racial inequities with regard to mental health and maternal mortality. Now, it seems that COVID-19 is exacerbating these inequities. What would you say to pregnant Black women who are very concerned and feeling anxious right now?
The rates of maternal mortality and severe morbidity in the United States are absolutely unacceptable. And even more concerning are the stark racial and disparities in these outcomes, particularly for Black women. As you said, this public health crisis has only exacerbated these existing inequities, reinforcing how incredibly important it is for all women to have access to high quality patient-centered care. Now, there's no way for me to walk in someone else's shoes, but I hope to let Black women know that these issues are absolutely of concern to me personally and to ACOG, the leading organization of OBGYNs, where I was fortunate enough to be president. Prior to this pandemic, my OBGYN colleagues and I committed to addressing racism and implicit bias in medicine, and doing it by changing our culture. And what this means is that we're committed to being active listeners. In fact, I am wearing, you may have noticed a button that I'm wearing, it says, "I'm listening." Every mom, every time. We are committed to examining our own prejudice and our own bias, and working with partners in our community to ensure the methods that we use to address this align with Black women's needs, values, and preferences. I've had the privilege of testifying before Congress on this issue, and I have advocated many, many times on the Hill for policies, for legislation that will help improve Black women's health outcomes. There is much, much work that still needs to be done, but I say to all Black women, all women who are anxious right now, that your OBGYNs are committed to you. We're committed to providing you with the very best care. We are listening, and we will continue to listen.
Thank you, Dr. Hollier. I know we're sort of at time. There's some questions that I've been seeing come through on Facebook, and I certainly want to make sure that we can address those and work with those. We will be following up. We will be monitoring this Facebook page. We will be sharing this amazing interview with Dr. Hollier in multiple times. So first and foremost, again, my sincere thank you to Dr. Hollier and to ACOG for all that you're doing for women in their 1,000-day window, but also for women who are thinking about becoming pregnant. I am just so humbled to be able to have had some time with you today. I am so proud of the community that we have built, and I'm so proud to be able to work with you as partners to answer these tough questions. So thank you so much. Anything else you want to share as we wrap up?
I just want to say thank you to you. You have built an amazing community. This is such a phenomenally important time, and I'm just profoundly grateful to have had the opportunity to talk with you and with your community today. So thank you for everything you do for moms everywhere.
Thank you. Well, as we like to say, 1,000 thanks. So 1,000 thanks to all of you. I hope you all have a good rest of your day. And again, to Dr. Hollier and to ACOG, thank you so much. We'll talk to you again soon.